This patient was referred to me for endodontic retreatment of tooth number 19 6 months ago. 6 months ago when I saw this patient, he said the root canal was done about 15 years prior and he didn't have any symptoms. His new dentist took some x-rays and had seen this dark shadow, this periapical radiolucency, and was concerned, so referred the patient to me for endodontic retreatment. We examined the tooth, percussion within normal limits, palpation within normal limits, probings 2 to 3 millimeters. There was no mobility, no pain to biting. As I said, patient had no symptoms whatsoever, and this root canal was done over 15 years ago. We tried to get x-rays from the patient's general dentist, and this is what we got. But these x-rays were from 2 months prior, so they were not very diagnostic x-rays. If they were from 2 months prior, I wanted something more like 2 years, 3 years, 4 years. Anyways, because this patient had no symptoms, we said, okay, come back and see me in 6 months so we can take our own radiographs again of the tooth, and if there are no symptoms and the periapical lucency hasn't changed in size, then we'll just monitor the tooth. Come back and see me sooner if there are any discomfort, any pain, any swelling, pimple on your gum, anything like that. Come back to see me sooner. Otherwise, I'll see you in 6 months. Well, today was that 6 months. So this x-ray is from today. As you can see, the periapical lucency has not changed in size, has not gotten bigger in 6 months, in the past 6 months. And patient has no symptoms whatsoever. So this tooth doesn't need to be retreated. The root canal doesn't need to be retreated right now. So we will continue to monitor this tooth. Patient can come back and see me in a year now, or his dentist in a year. And again, radiographs could be compared. But as of today, when we compare the radiographs from 6 months ago, the radiographs from today, this periapical lucency has stayed the same size. If there was an active infection, the periapical lucency would have gotten larger. So, moral of the story, don't, just because you see a periapical lucency doesn't mean you have to redo that root canal. If the patient has no symptoms, and just monitor the tooth for a few months and see if the patient really needs that root canal to be redone. All right, don't jump into redoing the root canal right